Vitamin D is important for keeping people healthy, but getting too much vitamin D can be bad for your health. If you have stomach pain, strange mental symptoms, or problems with your kidneys, you may have too much vitamin D. A blood test can also show that you have too much vitamin D. This video talks about 6 symptoms and side effects of too much vitamin D. Before we start discussing in detail, please subscribe our channel and also press the bell icon as well. Number 1. Elevated blood level. Vitamin D in the body needs to be higher than 100 nanograms per milliliter to be toxic or harmful. Hypervitaminosis D is when the blood level of vitamin D is over 100 nanograms per milliliter. Vitamin D intoxication is when the serum level of vitamin D is over 150 nanograms per milliliter. Different people have different ideas about what the best level of vitamin D is, but research shows that levels between 30 and 60 nanograms per milliliter are probably best and may help protect against illness and disease. Even if a healthy person took high-dose vitamin D supplements, it's unlikely that their blood levels of vitamin D would come close to being too high or dangerous. Most cases of vitamin D toxicity are caused by taking too much vitamin D or by mistakes with prescriptions. For example, a 73-year-old man who took 10,000 IU of vitamin D per day for many years was found to have vitamin D toxicity in a 2020 case report. In another case report from 2020, a 56-year-old woman who took an average of 130,000 IU of vitamin D per day for 20 months to help her multiple sclerosis was hospitalized with nausea, vomiting, and weak muscles. Her vitamin D levels were discovered to be 265 nanograms per milliliter. Keep in mind that 130,000 IU is more than 30 times the recommended maximum of 4,000 IU per day. Number 2. Elevated blood calcium levels. Vitamin D makes it easier for your body to use the calcium in the food you eat. This is one of the most important things it does. But if you get too much vitamin D, your blood calcium may reach levels that can make you feel bad and could even be dangerous. Most of the symptoms of too much vitamin D are caused by hypercalcemia, which means that there is too much calcium in the blood. Some of the signs of hypercalcemia are 1. Problems with the digestive system like vomiting, nausea, constipation, and stomach pain. 2. Fatigue, dizziness, hallucinations, and confusion. 3. Not being hungry. 4. Excessive urination. 5. Stones in the kidneys, damage to the kidneys, and even kidney failure. 6. High blood pressure and problems with the heart. 7. Dehydration. Calcium in the blood should be between 8.5 and 10.8 milliliter. Hypercalcemia usually happens when someone takes large amounts of vitamin D for a long time. If you take too much vitamin D, you may absorb too much calcium, which can cause several symptoms that could be dangerous. Number 3. Gastrointestinal symptoms. The main side effects of having too much vitamin D are caused by having too much calcium in the blood. Some of the most noticeable signs of hypercalcemia are nausea, vomiting, constipation, diarrhea, and poor appetite. But not everyone with hypercalcemia has the exact same signs and symptoms. After a woman took a supplement that later turned out to have 78 times more vitamin D than it said on the label, she got sick and lost weight. Importantly, these symptoms happened when people took too much vitamin D3, which caused their calcium levels to be higher than 12 milligrams per deciliter. Taking vitamin D can raise the amount of calcium in the blood, and too much calcium can cause side effects. If you take a lot of vitamin D, your calcium levels may rise, which could cause stomach pain, loss of appetite, constipation, or diarrhea. Number 4. Altered mental status. People with vitamin D toxicity can have a change in their mental state if they have hypercalcemia. People with hypercalcemia caused by too much vitamin D often have symptoms like confusion, depression, and hallucinations. In the worst cases, people have gone into a coma. Vitamin D poisoning can lead to symptoms like confusion, irritability, and inability to move or speak. This also seems to be caused by high calcium levels, which can happen when you take a lot of vitamin D. Number 5. Kidney complications. Vitamin D poisoning can sometimes cause kidney damage or even kidney failure. This is because having too much vitamin D in the body can cause high levels of calcium, which can make you pee a lot and cause your kidneys to harden. Hypercalcemia can also narrow the blood vessels in the kidneys, which makes the kidneys work less well. In fact, many studies have shown that people with vitamin D toxicity have moderate to severe kidney damage. An interesting fact is that not getting enough vitamin D can also hurt the kidneys and cause serious problems for people who already have kidney disease. That's one reason why it's so important to have the right amount of vitamin D in your blood. So that's it for today. Was this video helpful? Share your views in the comments section below. Also, don't forget to subscribe to our YouTube channel and press the bell icon for all the latest updates. Thanks for watching.